Welcome back. In this section, we're going to look at some of the main ligaments inside the female pelvis. So let's get started first with the ovarian ligament. So yes, the ovary is held into place. And if you look at this ovary, what you'll notice is there is a ligament that attaches between the medial aspect of the ovary and right around, just below where the fallopian tube attaches to the uterus. And this is known as the ovarian ligament. Yes, there's another ligament which suspends from the lateral wall of the abdomen, and we're not going to learn about that particular ligament. The next structure basically are the peritoneal folds, which are all lateral to the uterus and between that whole area. And they kind of look like, when the uterus is shown like this, they look like this big cape on the two sides of the uterus. And this is known as the broad ligament. So basically you're looking for where it doesn't look like a distinct ligament, like the ovarian ligament looks. And the third and final ligament, go to the sagittal view, okay? And apologies for this red arrow. That red arrow is actually pointing at the fallopian tube. So come just a little bit anterior to that in order to see the broad ligament. But if you continue anteriorly, can you see this white structure which is going towards the anterior abdominal wall on the inside? Okay. So that structure is the round ligament of the uterus. And I write of the uterus because there's more than one round ligament in the body. And where this round ligament is going, it's going and it inserts into the mons pubis by going through the deep inguinal ring. So both men and women have deep inguinal rings. But ladies, we do not have inguinal canals or superficial inguinal rings because we don't have any structures that travel through the anterior abdominal wall to get to the outside. And with that, we're done with our three ligaments. Okay, so once again, this is the round ligament of the uterus. Then when you pick anything that's lateral, that's not a distinct ligament, that would be the broad ligament. And then just inferior to the fallopian tube, you can see the ovarian ligament. All right, that's it. And I'll see you shortly as we look a lot more at the ovary.